Hi friends, Dr. Nancy Trimble here. Today we're going to talk about your lumbar disc issues. So as always, we're putting the knowledge and power of your health back in your hands. So just because somebody says, oh, your lower back, you have a slipped disc, a herniated disc, a bulging disc, it is not a death sentence. It is not guaranteed surgery. It is a 1 out of 1,000 chance that you may need surgery. So I've dealt with thousands of disc cases over the years. So I'm going to give you my tips and tricks. First of all, how do you know that you might have a disc problem, a lumbar disc, herniation, bulging disc, or inflamed disc? There is a typical presentation. This is not true for 100% of the people with it, but typical. Typically, you're going to be bent to one side. And this is unconscious. You're not trying to do this. Your body's putting you in this position. It's called antalgia. It's putting you out of pain. You may be not able to straighten up. You may be like this. If you let it go long enough, the muscles of your back will spasm so much you can't move any which way. But if you haven't waited that long, you can usually bend forward with no problem. It's leaning back that is typically the worst. So that's the typical presentation. How does it typically get caused? People will tell me, all I did was bend down and pet the dog. All I did was bend down to pick up a sock. And it's usually a bend with a twist, a slow twist. That's not what started it in that moment. You probably did something in the weeks or months prior that set the stage. And then that one little slow twist with a bend is what let that disc get inflamed or herniated. So what do? First of all, when you come into the office, we are going to make sure you are set up with a lumbar belt. It is a Velcro and elastic thing. We are going to make sure that you have an ice pack that is soft and flexible, because you're going to want to avoid sitting. Sitting puts the most compression on the disc. Actually, let me rephrase that. The most compression or the most pressure on your disc is when you're in this type of bend. We call this a 20-degree bend. When you stop there at 20 degrees, there's the most pressure here. This is the brushing your teeth. For men, shaving your face. For women, washing your face bend. That is going to put the most pressure. The second most pressure is with sitting. So you'll be avoiding sitting. So you're going to keep this lumbar, this lower back brace on 24 hours a day if possible, especially when you're sleeping, because when you sleep you tend to twist. And remember, that slow twist is the worst thing for the disc. This nice, soft, flexible ice pack, you'll use 20 minutes out of every hour, because we have to reduce the inflammation here. You'll put the ice pack between you and the belt, and you can walk around with the ice pack on 20 minutes out of every hour. The other thing we'll do is recommend that you use an anti-inflammatory supplement. Normally we want to use turmeric, and there's some other alternatives to that we'll recommend. There are some medications that are anti-inflammatory as well that will target that disc, but we have to do that to get the inflammation out of the disc and the nerve root area. And as a side note, a lot of people do feel pain into their butt, their hip, their leg, their lower leg, their foot when they have a herniated or slipped disc. How far it goes down your leg is important, but it doesn't change what we're going to do. It's still the same issue. It could be either leg, could be both legs, it might even switch. The other thing, and the reason why I have bacon, lettuce, and tomato with me today is because I will say to you, no BLT. This thing is going to kick your butt for a week or two. This disc herniation or inflamed disc or slipped disc. For 1 to 2 weeks, you're going to have to baby yourself. And the way you're going to baby yourself is no bending, and especially no bending and lifting at the same time. So think a laundry basket like this. No. And especially no bending and twisting at the same time. Remember, this is what can cause the disc to slip. So none of that, no BLT. So I hope that helps. If you have any questions, remember to call us, ask us. We specialize in disc issues. So bye for now.